I'm Torrance Walker, a orthopedic surgeon, working with Texas Healthcare Bone and Joint Clinic in Fort Worth, Texas.
And I'm Dave Brigati, also with the Fort Worth Bone and Joint Clinic, and we're going to be discussing minimally invasive direct anterior approach hip resurfacing for appropriate patients.
I'm Torrance Walker, an orthopedic surgeon. I did my hip and knee fellowship training at the Campbell Clinic. I did quite a variety of cases, including hip resurfacing, and wanted to bring this idea of anterior hip resurfacing to my patients in my practice.
I'm Dave Brigati. I did my training in Cleveland Clinic.
Hey,
Yeah,
Dr. Brigati.
Torrance Walker, Dr.
Good
Walker.
partnering with you, man, these last several years.
Yeah.
So, what we want to talk about today is the hip resurfacing. Now, what are your thoughts about hip resurfacing, and who would you offer it to?
So I like hip resurfacing, especially for younger male patients. You save a lot of bone on the day of surgery as opposed to cutting off a lot more on the day of surgery. You have a lot better revision options in the future if you're dealing with a patient who's so young that the technology of the day is probably not going to last the entire lifespan that they're going to live. And so, especially when patients want to do impact loading, running, jumping, sporting activities, it seems to be a more successful track record implant to get you back to where you want to be and have the least number of problems while you do those kind of activities. I did the training for this procedure as doing what's called a lateral approach, where what you do is you go through the muscles of the abductors that help the patient balance. What approach do you use, and how did you been teaching me that?
Well, when I first started hip resurfacing, the primary approach was a posterior approach.
Mm-hmm.
And that was approached through the gluteals, the butt muscles. And you have to make a long incision over the hip, and you have to split the gluteus maximus quite a bit. You have to do all these other releases of all the short external rotators and other muscles in the back of the hip. And I thought that was a really invasive approach. I'm interested in muscle preservation, joint preservation, and getting patients back up and going as fast as possible. I wanted to adopt the anterior approach for hip resurfacing. An anterior approach is a muscle sparing approach. So I liked that part. For one, I don't have to split all these muscles and repair them and then wait for them to heal, which muscle healing usually occurs with scarring. Versus the anterior approach where you spare the muscles, and the only thing that heals is the capsule and the fascia over the overlying muscles. So patients recovered really well and not faster. So, and people can be very active, especially nowadays when even mature adults, we call them mature athletes, want to stay as active as possible and do high impact things like running.
Mm-hmm.
Like you've had how many patients and what kind of patients conditions?
I've had basketball players in their 40s that are kind of spanning the gap between I want to teach my kids, but I also want to play. And we had the young man from Oklahoma where he ended up having bilateral hip resurfacing. He's getting back to pretty high levels of activity in terms of running. I've had patients who like to do jujitsu. This is a popular adult sport where you're having your limbs twisted around. We don't generally love that for hip replacement. It's not something I would like my patients to do when they're doing hip replacement, but hip resurfacing, I feel pretty comfortable with that. Yeah. So it really opens up a wider variety of sports where I try to be as encouraging as I can to my hip replacement patients. Hey, you can do whatever you want, but some of those sports, I don't like that.
Right. But
hip resurfacing, I feel very comfortable when they want to do that.
Yeah. I've had a guy who wants to keep running. He's an ultra marathon runner.
Mm-hmm.
So he's back in his training. Weightlifters.
Mm-hmm.
People really want to stay in shape and fit. But I like hip resurfacing, especially for those adults and people who want to stay active, doing high impact activities. I think it's a great procedure. And adopting the anterior approach makes it even better.
Mm-hmm.
It may be technically challenging, but we're up for it. We've done them regularly, and we want to offer those to our patients.
I appreciate you teaching me how to get these people up and going faster, because I know how to do it, but it's a different approach that really helps the soft tissue healing, which is a big part of the procedure. It's been great working with you.
Be working with you.